Hi folks, I'm Dr. Tom Meade. Welcome to another episode of our show. I'm here again with Dr. Eric Lebby, Chief of Orthopedic Surgery at Lehigh Valley Health Network. Eric and I were here 1 year ago when the pandemic began. Everything was shut down. Elective surgery was shut down. We did a show on the new normal, living with COVID-19 in the orthopedic world. We weren't doing surgery for 3 months. In the office was basically closed except for telemedicine. We didn't know how long it would last, Eric, but I don't think either of us thought that we would be here a year later and still in the pandemic.
Yeah, no, I did not expect us to be talking about it still to this day, but here we are.
Here we are. So what I thought we would do is give an update at 1 year, the new normal and living with orthopedic surgery and patients 2.0.
I think it's a great idea.
But instead of you and I talking about our experience over the past year, I thought we would look at it through the eyes of our surgical patients.
Yeah, I think it's a great idea, and you know, it seems like it's been forever, but I think it was actually 8 weeks that we weren't doing surgery. I think it was the middle of March till May 1st, I think. And it seems like it was forever and a year ago, doesn't it?
It did. And even though we got back, a lot of hospitals in Pennsylvania didn't get back to elective surgery.
And a lot of places still aren't where we are today, actually, and I think a lot of it is to be said about what we did as orthopedic surgeons and what our network did and our collaboration together to really make patients feel safe and really show that we can do the job and keep people safe at the same time.
Okay, great. So to see the experience of COVID through our patients, we interviewed them. We asked them 4 questions. Was their surgery considered essential? What were their COVID concerns about having surgery? What was their surgical experience? And what advice would they give to other patients? But here's a graph that shows a year ago, Eric, there were no deaths at this time in the Lehigh Valley. Who would have thought that there's over 500,000 deaths nationally? With that, I wanted to look at some quick statistics. I wanted to compare it to the 1918 Spanish flu. There were 675 deaths, but the population was only 1/3. So basically, that was 3 to 4 times as severe from a death count. The infections were about the same, 29 million for COVID, 25 million for the Spanish flu. But again, that was a 3 times difference because of the population. But let's look at Lehigh Valley. There were 1,430 deaths, but the majority were seniors over 65, and 82% were in long-term care facilities. So sometimes you have to look at the forest through the trees. And the risks, if you lived in the Lehigh Valley, of surviving COVID and you weren't in a long-term care facility were actually 99.9%. And sometimes you forget that when you watch the national news and it looks like Mr. Doom is on every night. This was a slide from CDC that said, look at the comorbidities. And if you had comorbidities like asthma, obesity, diabetes, hypertension, that even increased your risk. And they were magnified. So if you had 3 or more, your risk was 4 to 5 times the chance of being hospitalized. So again, if you lived in the Lehigh Valley, you weren't in a long-term care facility, and you didn't have these comorbidities, your chance of surviving was 99.99%.
And I think it's also important to understand that there are also outliers. You know, there are some normal, healthy people with absolutely no comorbidities that fell to COVID. And the same thing can be said for cardiovascular disease. Mostly cardiovascular disease is a disease of the elderly, a disease of people with multiple comorbidities. But you always get that healthy guy or girl that's jogging and drops dead from cardiovascular disease. So, you know, we can't also get scared of the outliers.
Let's hear from our first patient. Tom Carrell, 74-year-old patient, had a total knee at Lehigh Valley Health Network Coordinated Health. He's a businessman. He owned his own business and was still working in his garage for the past 50 years. He returned to work in 3 weeks after surgery. He did his own therapy and he took no narcotics. Okay, I have Tommy Carrell, 73,000-mile active businessman, still working, owns his garage for 50 years, 21-year veteran in the Army
National Guard.
National Guard. Thanks for your service. Appreciate it during the Vietnam
You're welcome.
Era had the right knee replaced many years ago, and I'm going to quickly go to the x-ray, and that's the old-fashioned knee, a lot of screws in there. We'll ask him some questions about that. The left knee preoperatively all worn out, no space left. So I'm going to go back to Tom. I'm going to ask him just 3 questions to fast forward, Tom, because you had surgery during the pandemic. But about a year ago, the recommendation from CDC was to shut down all elective surgery to save our equipment, our PPEs for a potential COVID surge. So they deem knee replacement and hip replacement as not essential. But some of my patients may think differently. So I want to ask you, do you consider your need for knee replacement essential?
Yes.
Why?
I was having so much pain with it, and with my job that I'm still working, I couldn't be on my feet for more than 2 hours, and my knee was just killing me. And I was always taking pills, and I hate to take pills for the pain in my knee.
Essential to function, make a living, do what you want to do, correct?
Right.
Question number 2. Did you have any concerns about having your knee procedure done during the pandemic?
No.
Why not?
Going to your hospital, I know you don't have any pandemic in that hospital, but the cleanliness of the place, the professional appearance of the place, and the people that they are there, they know what they're doing, and I felt safe going to that hospital.
Great, absolutely correct. And it's an elective hospital. We don't have active COVID patients, so that gave you a degree of comfort. Question 3, after you went through it, were you satisfied with the precautions at the hospital?
Very much so.
And
Yeah.
why?
They took care of me. I tried to crawl out of bed, and if it wouldn't have been for 2 nurses there, I fell flat on my face because I was still numb.
Gotcha.
But they took excellent care of me.
Great.
And treated me with the utmost.
And so, again, you had the other knee done many years ago, and were you in the hospital overnight?
I was in the hospital for 3 days.
Why is that? Do you know?
That's the way they did it. You had to get strong enough and good enough to walk up a flight of steps before they let you out of there. But that was a complete replacement, and I was laid up for 3 months, where with this one, I've been laid up for 6 weeks.
6 weeks.
6 weeks.
And really, we did this as an outpatient, correct?
Right.
So
That was outstanding.
you went home the same day?
I walked out of the hospital.
Let me ask you about your pain the day of surgery or the day after. How did you do?
I did pretty good. There was drugs available for me, but I didn't take any. I took ibuprofen and Aleve, and that was enough to take away the pain that I had.
And no narcotics
No narcotics.
per se.
None.
So last question is, if you have friends or family that needs a hip or a knee replacement, would you have any hesitancy recommending them having them now, still during the pandemic, since we don't know when it's going to be over?
No, not going to your hospital.
Okay, so very comfortable referring them to Lehigh Valley Hospital, outpatient.
Already recommended you to 4 different people.
Thanks.
So Eric, a lot of things we could talk about, and number one is the individuality of these patients and how many are motivated and how we read those patients ahead of time. And I think when you're motivated to get back to work and you can be 70 and retired for 15 years, or you could be working. But I think that's a great example. And when we say he didn't go to physical therapy, that doesn't mean he didn't do physical therapy. We instruct them. They go to therapy actually ahead of time, and they learn what to do 5 minutes, an hour after therapy.
Yeah, I mean, it's like I tell my patients, knee replacement and hip replacement surgery is a recipe, but it's really a customized recipe, and you really have to customize it to each patient. Tommy was his name, and he was a gentleman that was motivated, active. You could tell he was in good health. He's going to be one of those guys that's going to be ready to go back to work at 3 weeks. That's not for everybody. So there are some people that need the 3 months. That's why I tell patients, they ask me, Dr. Lebby, how long will it be before I'm back to normal? And I say, anywhere from 3 weeks to 3 months. And I know that sounds like a big stretch, but you have to take every single person into consideration. And you have to understand, like you said, people have different motivations, people have different aspects of what pain is and what pain isn't, and you really have to customize each case to each patient.
Yeah, no, I absolutely agree with that. The hard question to answer is people say, well, doc, how long is it going to take for my recovery? And you have to pause, and just because he's back to work in 3 weeks does not mean he is totally recovered. The long answer, it can take up to a year to be fully recovered, but you're not sick. You have a sore knee, you could work around it if you have common sense, and so that's why it's a difficult question to answer for a lot of patients.
It really is. And I describe to my patients, it's kind of like cutting yourself. When you cut yourself or have an injury, you cut your hand, that heals in about 6 to 8 weeks. But you still feel it, and it doesn't feel quite the same. And there's secret healing under that skin for up to a year to a year and a half. So, that's really the analogy that I explain with my patients.
And right, and you have to, the pain tolerance of different patients is different. And certainly with therapy, they won't torture themselves. They know how to push it, if you can pick the correct patient. So let's move on. And
one of mine, huh?
Yeah, let's look
right.
at a total hip replacement that Dr. Lebby did at Lehigh Valley Tillman. She couldn't walk, sit, and she'll talk about her post-operative pain and how this was a life-altering experience. And we'll see her interview right after this. Hi folks, welcome back. And now we're going to hear from Pam, a total hip patient of Dr. Lebby's.
So Pamela, you're about 3 weeks out from your hip surgery, is that correct?
Correct.
And where did you have your surgery?
Lehigh Valley.
Which one of our sites? The Tillman site, right?
The Tillman site.
Yes, right up the road from here, exactly.
Yes.
So did you feel that your surgery was essential?
100%. I couldn't walk.
Tell me about things before the surgery.
I was walking with a cane, and I was on my way to using a walker, and I was in pretty much excruciating pain. Even to sit was excruciating.
Right, so what if somebody had told you, you can't have the surgery now? This isn't essential.
That wouldn't have been a good... I don't know, because...
Wouldn't have gone down well with you, right?
No, it was not. I was not in a good place.
So tell me about your experience at Tillman. What did you, whether, your safety, the safety measures they took, how did you feel once you got to Tillman? Everything was
great. I felt comfortable. I was well taken care of. Everything went smooth. It was smooth. It was quick. And I was discharged amazingly quickly and felt way better than I did when I went in.
So what would your recommendation be to patients, possible patients or viewers that are watching this show that are thinking about hip or knee replacement surgery at this time?
I would not hesitate. I don't see how you could. If you were in the spot that I was in, to me that was essential. I mean, I don't see how you could say it wasn't essential. I mean, I couldn't walk. I couldn't walk, and it changed my life. And now my life is going to be changed back to what I had before, and so it's life changing.
Well, that's fantastic. Why don't you stand up for us? Show us what you can do 3 weeks out from surgery.
Absolutely.
I mean, that's pretty impressive stuff. I mean, you really don't even need a cane. You carry the cane just for protection every once in a while if you're going long distances.
Yeah, I think just unassisted to go any length of time. I went to the supermarket, brought the cane with me. I was walking around. I can shower unassisted. Yeah, and I do not even have close to the pain that I had before the surgery. So this changed my life.
Well, Pamela, I really appreciate your time, and I really think the viewers will appreciate your story. Thank you so much.
Thank you, Dr. Lebby.
I agree, Dr. Lebby. Great patient, great result. Why don't we just jump into another female patient, and then we'll discuss them both after we see that.
Sure.
First question is why did you need a knee replacement?
Well, playing sports in my high school years and in my college years, I've had some tremendous injuries and damage to my knee. So
How many surgeries did you have?
I've had about 5 surgeries. Dr. Meade's will be my 6th surgery, and
So in there was the answer. So I'm just going to kind of go really quickly because I want a couple things, but I'm going to sneak over to the x-ray machine. And for any orthopedic surgeons out there, if I show these x-rays, this could easily pass as an 80-year-old knee. Nobody would argue, if I didn't show your age, that you are a candidate for a knee replacement looking at this film, and they can see the screw here from your previous anterior cruciate ligament procedure. There's your kneecap, which has tremendous bone spurs or osteophytes. And I'm going to fast forward to your postoperative picture, which is really neat. The modern day knee replacement is like a cap on the end of the bone, where we don't replace that much bone, but it's more like a dental procedure, if you will, where we put a cap on the end of the bone. So that's a quick x-ray. But a couple quick questions that is really the focus of this interview is a year ago with this pandemic, which is really what I want to talk about, is a lot of elective surgeries across the country were put on hold. They called them not essential. They wanted to save PPEs and equipment for people with COVID, which was understandable. But if I asked you, do you think your surgery was essential or not essential? What would you say?
it was essential.
And why is that?
I literally had no quality of life before this surgery. I wasn't able to do things that, someone at my age should be able to do. And after this surgery, it's been nothing but I am able to do things I haven't been able to do in years.
Got it. So that was question number 1. Question number 2, did you have concerns about having surgery during the COVID pandemic?
Yes, definitely.
Why?
Everything that we read and see in the news with all of the precautions and dangers and the virus itself. So it was a very scary situation to come into a medical setting like this.
So at our facility, which isn't in a tertiary hospital where we don't care for COVID patients, so it's just for elective surgery, did that give you comfort in having surgery there? And after going through the experience, what would you say your comfort level was with the precautions that were available?
It definitely gave me comfort. I was still a little nervous. I believe my nervousness left when I walked through the door by myself and everybody had a mask on. I got my temperature as soon as I walked in, and it was a very sterile, organized environment that I went into.
After going through it, would you have any hesitation recommending someone who needed a knee replacement like you or a hip replacement to have it before this pandemic is over, which we don't know when that will occur?
I have no problem saying to go get a procedure done at Coordinated Health by any means.
That's great. And this was done as an outpatient. You went home the same morning?
I went home 4 to 5 hours later. The same day I was at home in the comfort of my own bed.
So, was that something that you would think you could do in your lifetime, have a knee replacement, go home the same
No,
day?
I was getting ready to, set up shop in a room and hang out for a day or two. I by no means was expecting to be told I'd be home the same day.
And today, how long after the surgery is it?
It has been 39 days since my surgery.
Okay. Could you straighten out your knee for me? Could you bend that knee backwards all the way? Good. Could you stand up for me? And can you get on your toes? Now I hate to ask this, but can you jump up and down like you're jump roping? Okay, that's terrific. You are an all-star. Last question is our new pain protocols. The only way we can get people home is on the day of surgery or the next day if we could control the pain. How did you do the first 2 days after surgery?
First 2 days, it was great. I didn't feel much of anything. The blocker that was put into my leg really made a difference.
We tell patients after the first 2 days, and we prepare them. As long as you're prepared for pain, and usually the 3rd and 4th day it hurts a little more. It's hard to know exactly how uncomfortable that will be. So we give patients a week's worth of narcotics, not 6 weeks like we used to. We noticed half our people don't use them, but we certainly want you to have those for breakthrough pain. How did you do, and did you need those the 3rd and 4th day?
3rd and 4th day is when I definitely needed to start using those pain pills. Took them as prescribed every 4 hours, and after the 4th day, I no longer needed them, and I was able to use Tylenol and ibuprofen.
Eric, here's a chance to discuss the difference between hip replacement and a knee replacement, the difference between young and old, and how do you address the question that we see when someone comes to your office and they've seen someone else or they've been told they're too young to have a knee replacement? And what are your parameters? How do you answer that?
Sure, and I think you said it earlier. I mean, a lot of it is how bad are you doing? How badly are you doing? How motivated are you? How young are you? And what are your expectations? I always talk to patients about expectations when it comes to a knee replacement. I tell them that God gave us the best set of joints we're going to ever have, and if somebody tells you otherwise, they're either God or a liar. And I'm kind of thinking they're the latter of the two. But if you are 35, 40, and you're feeling 80, and you have an x-ray like you're 80, it's hard to tell a patient, you have to wait till you're 50. And that's what we used to do. The cutoff actually in my training was 54. My mentor wouldn't even look at someone that was under 54 for a knee replacement. Things are different today. It's like you said, we do things differently. The components are definitely modified. And as long as a patient understands expectations, then it really can be done. We look at these complex situations, and your example was a good one. That where would she have been without what you did for her? She's a young, otherwise healthy woman who was feeling like a 60, 70, or 80-year-old. That shouldn't be.
Yeah. And I think COVID has brought a different sense of reality and mortality to some people, and they realize the most important time of their life is right now. And if they're miserable and the technology is such that we can help them, I think it makes them look at things through a different perspective.
It absolutely does. And looking at my patient, my hip patient, she was not an elderly lady by any means. And you could hear that she was miserable. And that's the biggest thing with this COVID experience that I think that we've learned is, we were told many months ago that your surgeries are not essential. And looking at my patients and seeing what they went through for that, those 12 weeks, they were miserable, and the surgery was essential. And you heard from these two young ladies how essential their surgery was. I mean, look at Pam. She was up in a couple weeks. She was in the grocery store. 39 days, your patient was up, jumping up and down. I mean, it makes a real big difference, and it changes these patients' lives. And anybody who tells me that these surgeries are not essential, I'd like to see if they went through what our patients were going through.
It's great. I think our viewers get a great appreciation of what COVID was like through the eyes of our patients. So stay with us. Thanks for joining us in this show. We will have another show with some more patients.